Good morning to all. Today we have gathered to observe the 25th Hepatitis Day function being organized as a joint initiative by ILBS and the Directorate of Family Welfare, Government of Delhi. It gives me satisfaction to participate in this immensely important awareness campaign of national relevance which Government of Delhi has led for the last 24 years. 3rd of December has been declared as the official Hepatitis Day for the state of Delhi. Ever since its inauguration in 2010, ILBS has been advocating for the elimination of hepatitis from the state and the country through various programs and on different forums. I have been told that in India, approximately 2 crores people are living with HBV infection and around 70 lakh people are living with HCV infection, of which 90% are not even aware that they are infected. Each year, around 1.5 lakh people die because of hepatitis, making viral hepatitis a major public health challenge that requires an urgent and dedicated response with appropriate prevention strategies. In the past few years, hepatitis has become a global health problem and is one of the diseases that kills most people in the world. According to WHO, estimates every 30 seconds a person dies in the world due to hepatitis B, and the number of deaths due to this infection in one day is more than the deaths due to HIV in 1 year. Viral hepatitis is a very common and serious disease in India, but its public health threat remains virtually unknown to healthcare providers, general people, at-risk populations and policymakers. Individuals with viral hepatitis B and C are at increased risk for liver cancer and chronic liver diseases, yet an estimated 70% of the persons with chronic viral hepatitis do not know what they are infected. It is heartening that having flagged the causes, perils and prevention of hepatitis way back in 90s, Dr. Sareen has since championed the cause and launched a mass awareness drive in the shape of Yellow Ribbon campaign in the country. The color yellow was chosen as it represents the color of jaundice, the most ubiquitous and conspicuous symptom of liver disease. Today is the silver jubilee of the Yellow Ribbon campaign. Congratulations to one and all. It was way back in 2001 that Dr. Sareen, along with his colleague, initiated the need for inclusion of hepatitis B immunization in the Universal Immunization Program, and we have not looked back since then. Delhi was the first state in India to launch the hepatitis B vaccination as part of the Universal Vaccination Program. Subsequently, ILBS, which is a WHO collaborative center, has been instrumental in developing the National Viral Hepatitis Control Program, which was launched in 2018 by the Government of India. The theme of 25th Yellow Ribbon campaign is hepatitis elimination, a social responsibility. The message is clear. It is now the responsibility of society to join hands and help in elimination of the menace of hepatitis B. All the citizens of not only Delhi but India should join hands. We are committed to create a success story in the field of hepatitis B by spreading awareness for the prevention and cure of the disease amongst the people in Delhi by motivating them to get immunized against the disease. Patients living with hepatitis suffer from a huge social stigma. Often they are stigmatized and marginalized not only at workplaces but in day-to-day life in the society. This year's theme is a reminder to all of us to give these people same status as they one of us. I was witness to the efforts made by ILBS through the Empathy Empowering People Against Hepatitis Program campaign organized on July 28th of this year in Parliament. Everyone present there pledged to work for the cause and to give people living with hepatitis their rightful status in the society. I have been informed that the organizers are using various means for imparting knowledge, including poster competitions and family connections, counselings, etc. Various cartoons and posters exhibitions have been organized for public awareness, wherein school students, nurses, healthcare workers, and medical students display colorful and imaginative posters describing the modes of transmission, prevention, and treatment of hepatitis. I hope when you leave from this place today, you would be wiser about hepatitis prevention. The onus is now on you to take up this noble cause. Let the message spread like the wildfire. Ask your parents whether they are immunized, whether your siblings are immunized, and if not, then educate your parents of the need for seeking earliest possible vaccination so that we can hope for a hepatitis-free India by 2030. It is myth that immunization is only for newborns and children. Hepatitis B vaccine can be and should be taken at every age to protect the individual. I compliment Dr. S.K. Sareen and the team of ILBS for their efforts and human service and reaffirm our commitment to continue with the government's unflinching support to the Yellow Ribbon campaign. Jai Hind.